Hey there, welcome back. As we move out of February and step into March, this is one of those months where Social Security can feel a little off, you know? And here's something that catches a lot of people by surprise. Some recipients will actually not see an SSI payment at all during March, at least not in the way they expect. And that can feel stressful if you're not prepared for it. At the same time, over 70 million Americans are still relying on these payments every single month to cover the basics: rent, groceries, medications, all of it. So, yeah, today we're walking through the Social Security payment schedule for March 2026, what's actually happening with the timing, and a few important updates that could affect how you experience your benefits right now. And understanding this clearly can really help you avoid unnecessary stress this month. And before we get into it, let me ask you something simple. When your payment timing changes even a little bit, does it throw off your monthly planning, or have you gotten used to it over time? Let me know in the comments. I always like seeing how people handle this. All right, so let's start with the biggest thing people are noticing in March, and that's the SSI situation, because this is where most of the confusion is coming from. If you receive supplemental security income, your March 2026 payment actually arrives early on Friday, February 27th. And the reason is pretty simple. March 1st falls on a weekend, so the system pushes that payment forward to the last business day before. So if you get a deposit at the end of February, that is your March SSI payment. And yeah, this is where it can feel a little uncomfortable because when March actually arrives, there's no new SSI payment coming in that month. It's not missing, it's not delayed. It was just paid early. The Social Security Administration has even explained this directly, saying that when the first of the month falls on a weekend or holiday, they send the payment early so you're not left waiting. But it doesn't mean you're getting extra money. And this is one of those moments where timing really matters because if you're budgeting month to month, it can feel like something disappeared, even though technically it didn't. Now, if you receive both Social Security and SSI, or if you receive Social Security before May 1997, your Social Security payment is scheduled for Tuesday, March 3rd, 2026. That date stays consistent and follows a different schedule than SSI. And for everyone else receiving Social Security retirement, disability, or survivor benefits, your payment is still based on your birthday. So if your birthday falls between the 1st and the 10th, your payment arrives on Wednesday, March 11th. If your birthday falls between the 11th and the 20th, your payment comes on Wednesday, March 18th. And if your birthday falls between the 21st and the 31st, your payment arrives on Wednesday, March 25th. So when you zoom out and look at the full picture from March, SSI payments came early on February 27th. Social Security payments for early recipients arrive on March 3rd, and then the rest follow on March 11th, March 18th, and March 25th. And if your payment doesn't show up right away, Social Security usually recommends waiting about 3 business days before reaching out, because sometimes banks just process things a little slower, especially around weekends. Now, beyond the schedule itself, there's a bigger conversation happening right now around Social Security, and it's something that a lot of people are starting to pay more attention to. There was a recent update from the Congressional Budget Office, and it showed that the Social Security Trust Fund could be depleted by 2032, which is actually 1 year earlier than previously expected. And if nothing changes, benefits would continue, but they would be reduced to match incoming revenue, which mainly comes from payroll taxes. So, what does that mean in plain terms? It means there could be about a 7% reduction starting in 2032, followed by deeper cuts after that if the issue isn't addressed. Now, that's still several years away, and a lot can change between now and then. But it does highlight something important. Social Security is stable today. Payments are still going out, but there are long-term questions that policymakers are going to have to deal with. And, for a lot of people, that creates this mix of feelings. On one hand, you're receiving your benefits as expected. On the other, you're hearing about potential changes down the road, and that uncertainty can sit in the back of your mind a little. Now, speaking of how things feel right now, let's talk about the cost of living adjustment for 2026. Because by March, people have had a few months to really see how it plays out. The COLA for this year is about 2.8%, which works out to roughly $50 to $60 more per month for the average retiree. And on paper, that sounds helpful. But in reality, a lot of people are saying it doesn't stretch very far. And a big reason for that is Medicare. Medicare Part B premiums increased again in 2026. And for many people, that premium is taken directly out of their Social Security check. So even though your total benefit went up, the amount you actually take home may not feel much different. And, I've seen comments where people say it feels like getting a raise, but your bills went up faster than your income. And that's a pretty accurate way to describe it. Now, there's also been a lot of discussion around taxes this year, and this is something that caught people off guard. Some retirees received retroactive payments after changes to older rules, specifically the windfall, elimination provision, and government pension offset. These changes restored benefits for a lot of public sector workers, which was a positive move overall. But here's the part that surprised people. Those lump sum payments can be taxable, and depending on your total income, up to 85% of your Social Security benefits can be subject to federal tax. So some people who receive those larger payments are now seeing smaller refunds or even unexpected tax bills. And in some cases, it can also affect Medicare premiums through something called IRMA, which is based on your income level. There's a proposal being discussed right now that could remove taxes on those restored benefits, but as of now, it hasn't been passed. So it's something to keep an eye on, but not something to rely on just yet. And then on top of that, there's also a new $6,000 tax deduction for seniors aged 65 and older. And at first glance, that sounds like meaningful relief. But here's where it gets a little tricky. That deduction lowers your taxable income, but it doesn't necessarily reduce Medicare premiums because those are based on a different calculation. So you might save on taxes, but not see a change in your healthcare costs. And yeah, this is where Social Security can start to feel a bit complicated because everything is connected. Your benefits, your taxes, your Medicare costs, they all interact in ways that aren't always obvious. Now, another big change happening right now is how Social Security itself is operating behind the scenes. Starting in early March, the system is shifting toward a more centralized model. Instead of local offices handling most cases, work is being distributed nationwide. So someone in a different state might actually be working on your case. The idea here is to improve efficiency, especially as the agency deals with staffing shortages. Thousands of employees have left over the past year, and the system is trying to adapt, and for some people, this could be helpful. It might reduce backlogs and speed things up in certain situations, but at the same time, there are concerns. Just pausing for a moment to share something important with you. We've partnered with Chapter, a service we feel confident recommending for clear, honest Medicare help. They'll connect you with a licensed advisor, compare every Medicare plan in your area, and help you save money. Most people save around $1,100 a year. It's free, and their care advocate team is there to support you even after you're signed up. Call 615-639-1937 or visit askchapter.org money using the link in the comments below. Let's get going. Because local offices used to have a deeper understanding of specific state rules and individual cases. And when things become more centralized, it can sometimes feel less personal and maybe a little harder to navigate if your situation is more complex. So, yeah, it's a transition, and like most transitions, it might take some time before things feel smooth again. Now, stepping back for a second, when you look at March as a whole, this month really highlights something important. It's not just about when your payment arrives, it's about understanding how timing works, how policies affect your actual take home amount, and how changes inside the system can shape your experience. And if there's one practical thing to keep in mind this month, it's this. If you receive your SSI payment early at the end of February, just be mindful of how you pace that money through March because it has to last the full month. Also, it's always a good idea to double check your direct deposit information. Keep an eye on your account around your payment date and be cautious of any unexpected calls or messages claiming to be from Social Security. So, yeah, as March moves forward, the system is still doing what it's designed to do, sending out payments to millions of people on time. But at the same time, there are changes happening, both small and large. They're shaping what Social Security looks like going forward. Take care, and I'll see you again.